All right. So for my next trick, we're going to do wisdom teeth anesthetic. So we're doing all 4 wisdom teeth. So I'm going to do 3 septocaine, 3 lidocaine. First septocaine, so we're 1, 2, 3. This one goes back 45 degrees up and 45 degrees in. About 3/4 the length of the needle here. And then we're going to give half of the septocaine. Now we're going to go downstairs. We're going to do the long buccal. We're going to come 45 degrees back and straight down the side of the mandible there, about 2/3 to 3/4 the depth of the needle. Do about another 1/4 of the septocaine. Okay, now we're going to switch. I'm going to place in the bite pillow. Open nice and big for me. Good. Relax that down in there. Good. I'm going to switch to the mirror. I'm going to give pressure anesthesia right here where the greater Palatine. A little pressure there where it blanches, and then we're going to place some anesthetic right in the crook there. Okay, and we're going to give about the last 1/4 of a carpule of the septocaine. You're doing great. Okay, and I hold it upright. Kaylin's going to grab from the top right here. Good. And she holds for me there. Great. Okay. All right, now I'm going to do the IA block here. I grab the ramus, the indent right here. I'm going to place right above my thumb, right at the level of the osseous. I'm going to sound very gently because we don't want to bend the tip of the needle. And then I'm angling back and slightly upward to the hub. And then I'm going to place half of the septocaine. Very good. Okay. Open nice and big for me there. Very good. And relax back down. Good. Okay. And then we're going to do the same thing, a little bit in reverse order. I'm feeling for that anterior notch of the angle of the ramus, or the ramus of the mandible. I'm going to place just at the top where my finger is at. Sound gently to bone. And then angle my way out and up to the hub of the needle. Finish off the last half of the septocaine. And as always, try to use my Bob Ross voice. Just a happy little tree. Just a happy little tree. Okay. Long buccal. Coming down here. 45 out. About 2/3 the depth. 1/4 of a carpule. Doing these in kind of reverse order now. Okay. We're going to come back up here on the roof of the mouth. Greater Palatine. Pressure anesthesia. Press it for just a few seconds. Wait for it to blanch. Insert. Big sting, big sting. Good job. Let me place another. You'll see it blanch sometimes and kind of a little bolus of anesthetic there. Okay, you're doing so good. That one's the most uncomfortable one generally. Okay, and then open for me nice and big. Good. Switch out here. Maybe turn away from me just a little bit. Other way. There we go. Okay. And open about halfway. Good. I'm going to use the Minnesota to get good visual. And then we're going to do the same thing that we did on the other side. 45 degrees back and 45 degrees to the midline. And about 3/4 the length of the anesthetic syringe, of the needle there. And we get the last 50% of the septocaine. So we use 3 septocaines. Now we're going to go back through, turn toward me. Let's suction. We got a little bit of juicy juice there. Close your lips on that. Kind of tap, tap, tap. Good. All right. Okay. So now we're going to come back in. I'm going to give a full carpule of lidocaine to reinforce the IA block. Open a little bit bigger for me and relax on that. Great. Okay. Thumb in the notch, right above the top of where the thumb is at. This is sound gently to bone. Walk your way back, flaring out laterally as far as you can and upward to the hub. And I'm going to place the entire carpule of lidocaine here. And I'd like to kind of go back and forth just a little bit, but not a whole lot. We don't want to be going up and down, up and down, up and down. But we do want to place in a little bit of an area. Okay. And then coming forward, I'm going to add just a little bit more to try to get a little bit of that lingual. Now, to ensure we get the lingual, I'm going to switch to my mirror. We're going to come in on the lingual side of this tooth. All right, you're doing great. I'm going to come in. Right here, coming in on the lingual side. We're going to place about a half a carpule to a quarter of a carpule on that lingual side of where the wisdom tooth is at. Very good. And make sure that we get everybody, if the mylohyoid is doing any shenanigans there. Open nice and big, we'll catch that. Suction. You're doing great. You're doing really good. I know that's all so delicious. And tap, tap, tap on that. There you go, perfect. Good job. All right. Left side's all done. Sorry. You're doing great, no worries, no worries. Girl's gotta swallow. Okay, coming back in here. Hitting the lingual mylohyoid on this side. We're just going kind of behind, tracking along behind the bone, kind of angling down. You can see that. That's all right. Doing all right. Where that bolus wants to go, we want to just get that on the lingual side. I'm giving the last quarter of the or the lidocaine here. Okay, about half to a quarter of that. Okay. And then we're going to finish up here with the reinforcer of the IA. Notch here above the finger, sounding gently to bone, falling back, going laterally as far as I can to the hub, slightly angled up. And we're going to basically the entire carpule of lidocaine. And if you use this technique within 15 minutes or so, this will have absolute profound anesthesia about 90 to 95% of the time. Open for me just a little bit. And as we all know, 90% of statistics are made up on the spot. So